Hi, good afternoon. I'm Dr. Craig Smith. I'm one of the Dooley urologists, and I'm here today to talk about Foley catheters. As a patient in urology, there will be occasions where you may not be able to empty your bladder, called retention or partial urinary retention, or have a procedure that requires a Foley catheter after the procedure. This is a Foley catheter. This is the portion that drains to a bag, and this is a portion that's inserted. When a Foley catheter is inserted into a male, it goes through the tip of the penis, through the urethra, past the prostate into the bladder. It will finish in a situation like so, and this portion of the catheter is where a balloon inflates to hold it into position. In a female, it goes through the shortened urethra here and is held into position again by the balloon that's inflated in the bladder. So when a catheter is in place, the balloon that's in the bladder will cause irritation to the bladder lining. The most common response to that irritation is a bladder spasm. A bladder spasm will be a sensation that you have to go to the bathroom. It's a contraction of the bladder trying to actually get rid of the catheter. They're common, and there'll be some medicines we can use to lessen bladder spasms. One thing that also occurs during a bladder spasm is some urine in the bladder will pass around the catheter and leak outside. That will be frustrating because you'll feel that the urine should stay in the bladder or come through the tube. But a bladder spasm is the #1 cause of urine coming around the catheter. With a catheter in place, on occasion, there may be no urine output. And why is that? And how to help correct and allow for good fluid to go back through the catheter. #1 is a kink. Is the tube kinked? Is it on an angle that's not allowing for drainage? #2, could there be blood in the urine, and could clots of the blood occlude the tube? If we look at the end of the catheter, urine's draining through the small port. This port can be occluded by blood or other products to not allow urine to get out. In patients that have had a procedure and there is blood in the urine, it can lead to clots, and no urine output from the Foley into a bag can occur. That is a need for concern and for urgent evaluation. Often what is required is irrigation of the catheter on the end that's exiting out to see if we can reestablish flow. Pushing fluid in and pulling it out can pull out clots as well. Attention in an emergency room, immediate care, or back in our office should be seen soon to get the system draining well again. So you've had a catheter in now for a period of time. Perhaps it's been a procedure, and they have requested that you can remove the catheter at home, or you're having the catheter removed in the office. How to remove the catheter? We can certainly deflate the balloon that's inside by pulling the fluid out from this port. But also another way to do this at home is to actually cut the port with scissors. Sometimes we'll actually mark this area with pen. So it'll be a pen mark. Please cut here. And by doing so, fluid will exit out from here, deflating the balloon inside, and allow for easy pull of the catheter and removal.